Hello, this is Chelsea Marks, and I'm filming for VETT 222, task number 2, which is perform a packed cell volume and a total protein on a collected sample. So first thing I'm going to show you here is, again, on our wall we have our OCCI certificate for Evergreen Veterinary Hospital. I'm going to go ahead and zoom in here so you can see that real close. Here we are at Evergreen Veterinary Hospital. Perfect. And zoom out. Okay, so I'm going to show you the supplies I've collected here to go ahead and perform the PCV and the total protein. So I have my pair of gloves here to collect the sample out of the tube with. I have our sample, which is an EDTA anticoagulated blood sample, at least 1 ml. You can see that here. We have at least 1 ml in there. So it's a properly collected sample, and it's for patient last name Callahan. So we're going to be running a PCV and total protein on him today. We have our microhematocrit tubes that we're going to place some sample into. We have our clay for stopping the microhematocrit tubes, packing it into the end. We have our refractometer here. We have some laboratory wipes to wipe off the capillary tube with. We have a note and a pen to write down our values once we're finished. We have our microhematocrit spinner for our centrifuge with labels around it with numbers and the little slots for the tubes. We also have our card reader, which happens to be a round one, and I will explain this further and in better detail. Let's see if we can get closer when I go ahead and read it. So this actually sits on top of our centrifuge ring here, and you read it that way. So we will go ahead and put our gloves on. And whoa, Nelly! I want to note that I'm also wearing my lab coat. So I'm going to move in a little closer so you can see exactly what I'm doing here. So we have our sample, and we're going to invert it 4 to 6 times gently. Okay, so now that we have our sample properly mixed, we're going to go ahead and take the lid off. And we want at least 2 of these little capillary tubes filled halfway to 3/4 full. We like to do 3/4 full because halfway doesn't read well on our card reader there. So I'm going to go ahead and introduce the tube into our sample. And we have about 3/4 there. And I'm going to go ahead and wipe that sample. And then on the end here, we're going to place it into the clay and pack that end. So we have a little bit of white clay in the bottom. We have our 3/4 full sample here, and we're just going to set that here. We're going to do one more. So again, introducing our microhematocrit tube into the sample until we get to approximately 3/4 full. And we're going to recap that because we don't need it anymore. Let's set that aside. We're going to wipe our capillary tube with a Kim wipe. We are going to place this tube into the clay. Okay, so it looks like we have a little white stopper. We have 3/4 full with the patient sample, and we're going to set that here. We're going to close our tubes here, set that aside, and move these aside for a little bit later. So now that we have our tubes here, we're going to go ahead and place them into this spinner. So I'm going to use, let's see, slot number 1 as well as slot number 13. Just want to show you here. We are taking care that we always place the clay to the outside of this ring so that when it spins, the clay stops the blood from flying out. So we're going to also place this one clay side out down into the spinner here. So that looks pretty good. Here we are. And I'm going to place the top of that on. Okay. And we're going to take a little trip with our camera over to our centrifuge because it is not in this room. So here we go. Taking a little trip over here. So this is our centrifuge here. We're going to go ahead and place it down into the centrifuge. It can be a little tricky because ours is old. There we go. We got it placed down in there, nice and tight. We're going to grab the top clamp that screws down and keeps that in. All right, nice and tight. We're going to shut the lid here. Go ahead and back up. So this machine only goes to 12,000 RPMs. So we have it set at 12,000 RPMs because that is the manufacturer recommendation for a micro hematocrit. And it runs for 3 to 4 minutes. So I have it set at the 12,000 RPMs. I'm going to turn it to high. I'm also going to turn the power on. And then I'm going to set it for the 3 to 4 minutes. So turn the timer past the 5 and then down to the 4. So back to task 2. We are here checking on our centrifuge and it looks like it's finished. So we're going to go ahead and open it, and it has stopped spinning. So we are safe to go ahead and touch it. We're going to collect out our PCV spinner here out of the machine and close that door. Turn it off for the next person here and close that door to prevent any dust from going inside of it. So we're going to take our sample here, head back over into our area that we're going to perform the PCV at. And so we have our card reader here and we have our sample that just finished spinning. So we're going to go ahead and open it up. So we have that. First thing we're going to do is note any lipemia or hemolysis. And it looks like they're both really good. I'm going to take it out and just show you up close. That's a nice clear sample here that we have, and a nice amount of red blood cells, cell column in the bottom. So we're going to go ahead and measure these. So I'm going to move them a little closer together. It's easier than using it across. So I'm lining up the bottom of the red cell column with the 0 marker here, as well as lining up the top of the plasma with the 100% marker on this reader. So what I'm getting here, when we line that guy up, looks like, you don't want to include the buffy coat, you're just going to the top of the red cell column, looks like about 39. So I'm going to check the other one, slide that over to align the bottom of the red cell column with the 0 and the top of the plasma column with the 100%, and this one looks like 39 as well. So I'm going to go ahead and take these samples out. We are going to put this to the side, we don't need it again, and we are going to note on our little sheet of paper here that we have a 39% PCV. Okay, here we are. And we're going to move on now to showing the total protein. So we're going to go ahead and get our refractometer out, not including the buffy coat, and scoring somewhere kind of, a third of the way up into the plasma level. We're going to go ahead and score this with the side of a microscope slide. There we go. And then break it. So we have our broken tube here. We don't want to use the side that has any sharp glass or anything like that. We like to just tap it out using the side that's not sharp. So we're going to go ahead and use that side, tap it down onto the refractometer really gently. These guys are pretty sensitive. You don't want to scratch the glass at all. So we've used a little bit of that plasma here. I'm going to go ahead and use the other one as well because we didn't get quite enough. So scoring that glass with our microscope slide here, snapping it right at that level, and then gently tapping a little bit more of our plasma sample onto the refractometer. So once we have that on there, we have our sample, we're going to put the top back across it, We don't have any glass or anything on there, so it's going to read really well. So we're taking our refractometer and looking up to a bright light. So here, perfect. And we're going to focus in by using the little dial on the eyepiece, and it looks like we're getting a reading of 7. So I'm going to go ahead and get this verified by my preceptor, and she will be right back in this video. Hello, this is Chelsea, and we're finishing up VETT 222, task number 2, which is a total protein. So we have our refractometer here, and I have a result, and I'm also going to have my preceptor, Dr. Magruder, verify the results as well, and then we will record it. So she's using the refractometer, looking up at a bright light.
I see 7.
And she got 7 grams per deciliter as well. So we're going to go ahead and write that down. We have that on our chart here. I'm going to go ahead and clean our refractometer with a little bit of water, as well as the top of it here. And then wipe it down. I'm going to use some gauze. Wipe it down to dry it. Okay, and now it's ready for the next person.